Good morning. It is Friday, October 22nd. Welcome into the Morning Medical Update. We, of course, are live here inside the Dolph Simons Family Broadcast Studio. Thank you to everyone joining us today on Facebook and YouTube. We are glad you are with us. It is Follow-Up Friday, so that means we're going to get to some of your missed questions from earlier in the week. We've got Amanda Cackler with us today to help answer those questions alongside Dr. Hawkinson. Good morning to you. You're joining us with some numbers. Any updates? What you got?
Yeah, I mean, I think it's always good news when Dr. Stites isn't here and we have a decrease in our numbers. So we actually do have a decrease. We were up to 22 active infections yesterday, and for most of this week, we're down under 20 right now. We have active 18 infections that are active, 8 ICU and 5 on the ventilator, with 23 in that recovery period. Of those 18 active infections, we should say that 3 are fully vaccinated, and none of the people in the ICU are fully vaccinated. Hays also has 7 active infections and 4 in that recovery period
Question,
as well.
because we get this question on our feed sometimes. These when the numbers go down and that looks good, and then they pop back up again. They're always wondering if that's just kind of this anomaly. Kind of what gives with that?
Yeah, absolutely. I think we've always said let's look and see what that 7, 10, and 14-day trend is. Certainly we knew that a couple weeks ago our trend for 7, 10, 14 days was going down. Over this past 7 days, so it's really kind of stayed stable in that really high teens to low 20s range. So this could just be that one data point anomaly, but I think more importantly is waiting over the weekend and waiting for this next week and really see what those case numbers are.
All right, before we get going today, any reporter questions on the line for us?
Sure, I have a couple. Cody Holyoke with Channel 9. Happy Friday.
Hi.
Hey, a couple of things that just happened in the last 12 hours. First, about an hour ago, Pfizer came out ahead of the advisory panel meeting later on next week, saying that its shot developed for kids ages 5 to 11 was about 91% effective or so. I'm curious, this probably goes along with the data that you've been watching, or what's your reaction to that?
Yeah, I mean, I think that's great. I think that's consistent with the other age groups that we've seen. Any of these vaccines that have been tested in children. We've seen it consistent with that adult and adolescent population. And you know, we don't want to rest on the numbers, 91% effective, 93% effective. First of all, what are we talking about effectiveness? I believe in these studies, they were looking at any disease. So that's really any PCR positive test, but I would have to look at the study itself. Most of these trial data and trial studies are looking at any disease. So that's just if they tested you and you were PCR positive, that's what they're calling infection. So a lot of the trials are looking at that. So if it's 91% effective, that's really similar across what we saw in adolescents and in adults, and I think that's great. We know overall, luckily, children are not as affected in the preponderance that adults and older people are. Older children. So that's a good thing, but this is one more thing to help protect them, but also help protect spreading it to others more vulnerable in the population, in the home, and in the community. So I think it's good news. We know that they're safe. We know the vast benefits that vaccines have brought to children and this country for vaccine preventable diseases, and we need to keep those going. This is one more thing that we can use to help keep people well, help keep children well, because we know children still are at risk of severe disease, even if it's a very small or minor proportion of children. It would really hurt and be sad if it was your child or somebody you knew. So I think that's good. We also know children can be affected by long haul syndrome, and we do have good data to show that vaccination does help prevent long haul syndrome as well. So overall, this is good news. We believe it's safe, and I think a lot of parents are waiting and hoping for their children to be vaccinated soon, and I think that would be a good thing.
Nice. And then my second question, this actually came last night. The director of the CDC signed off on Moderna and J&J boosters.
Yeah.
Just sort of a news you can use department here. What's the process if I qualify? Is there anything that people need to know? What should they bring? What should they expect as the booster rollout starts?
You know, as far as I understand, there's really nothing to know or bring. I think the biggest umbrella for those people that got Johnson & Johnson is really they are able to get any vaccine second dose that they want, as long as it's, I believe, 2 months out from their first dose. they are able to get anything. And so I think that's important. I think we know people do have some hesitancy either prior to getting one dose, but again, we want people to just really start to get their first dosing of vaccines. But if they have gotten their first dose, if they had some acceptable side effects that we know about, such as fatigue or chills or sore arm, with one dose or the first shot, we know that you can go ahead and get a separate or different platform for your second. So I think that's good to know. They've kind of really opened it up to get any vaccine now for your second dose if you got Johnson & Johnson first. Now, if you got Moderna, the first 2 doses, they also allow really for that mixing and matching, because we have really good data that all of these vaccines are safe, and the benefits that they provide are overwhelmingly vast compared to the minor risks that any of these vaccines provide.
Gotcha. And either for you or Amanda here, or is KU, are you guys going to start doing boosters today, or what's the timeline for you?
Yeah. Oh goodness, I feel like we're ramping up and hopefully going to be able to start next week. As I was talking to Adam Meyer, who's really been helping get that coordinated, and I think we'll be ready as early as next week.
Yep, and I know for Pfizer, which again, there has been boosters available for certain populations. Again, a lot of the criteria are similar for all of these vaccines. We have been being able to give those in our health system already, so we are definitely ready.
Thank you.
Other questions? All right. Okay, start sending in your questions. We'll get to those in just a bit, but let's bring in Amanda Cackler. How are you?
Good morning. I'm doing well.
Director of Infection Prevention Control. Glad you're with us today to help us answer some of these questions.
Of course. Happy to be here. Always happy to be here.
Okay. All right, so let's get going with some of our community questions, and we'll get to some that are coming in today here in just a moment. First one is, should we be concerned about the new variant? First of all, just tell us what this new variant is and if we should be concerned. Dr. Hawkinson, get started on that one.
So again, I think we have to put a lot of this on. We have the technological ability to really sequence and identify so many isolates around the world every day. So we have then we are able to identify any new variants or changes in the genome that may occur. This has happened really since the beginning of the pandemic. It's kind of ramped up more, and we've seen variants of concern that have arisen: alpha, beta, delta, gamma, all of those different variants. Now there seems to be a new Delta Plus. A few weeks ago there was a Delta Plus that was identified. Obviously that had never took really too much hold. Now there is a new variant in the UK that has been identified that has just kind of increased in proportion in the number of cases. But what is the real significance of that? We know also that England has kind of lifted a lot of restrictions, so is a lot of the increase in proportion of cases just due to people's behavior? That is certainly a large component. But overall, the new variant that they have seen, a few different mutations or changes in the genome. How really does that affect the virus itself? Is it more transmissible? We don't really have a lot of those answers, but we do believe that overall what we have seen is that the variants, we continue to have protection from the vaccines, even against the variants that we don't know of. Right now, again, the World Health Organization does not deem this to be a variant of interest or a variant of concern, but we will keep up to date on the news and look to see if, in fact, does this seem to be more transmissible? Does it cause more severe disease? These are questions that we ask of any variant that we've identified and arises. But right now, I don't believe there's any immediate concern. We know that the vaccines continue to provide great protection even against all the variants that we've identified. But if any new information comes up, we'll certainly report that to you.
How soon after the shot do you think kids will get good protection from COVID?
I think it's going to be very similar to when adults get the vaccine. So within that couple of weeks post that second dose, they'll have that good immunity.
Yeah, and I think you do begin to develop some sort of immune response even as soon as 10 days after that first vaccine, but it's not optimal, it's not maximal. But as you get further out from that first dose, and then of course, most importantly, just like Amanda said, is really after that second dose is when you have that maximal protection.
And what's the rollout going to look like? What are we going to be doing to help when it is approved? Do we know what that's going to look like? We've had a couple questions. Are we going to be teaming up with Children's Mercy? How is that going to look when kids get approved?
I wish that I knew the answers to that. I know we are going to have it available. I know we're going to have it in our clinics. I'm certain that we'll do everything we can to optimize the distribution of it. I just don't know what the logistics of that look like, but I know we have it available and we're excited to get ready.
We might have clinics for them the way they did for adults.
Yeah.
It won't be like they have to get it through a doctor. They would just come in and line
I
it up.
think they're gonna try and do it through places where kids are in like a trusting environment, through the school systems, through their physicians' offices. I don't think they'll be doing, we will probably offer clinics like they did for adults, but I really think they're going to try and push them through the school systems and the primary care offices.
Yeah, and I think, again, the good thing is we can give these vaccines with other vaccines at the same visit. So for adults, that includes things like influenza, tetanus, shingles. But for kids, we know the vast importance of getting those childhood vaccines as well. And I think as we move into the winter months and especially the holidays, I think that's very important. This is one more thing people can do to take the steps to keep themselves safe, keep their children safe, keep the people around them safe, because we know what happened last year and the tragedy that occurred last year with the surge and the spike. And this is one more step to help prevent transmission and keep people well. We've also seen all of those stories about the families and the children that have been left as orphans because the families have died. So I think this is one more step to help protect against transmitting the disease to others and getting it individually as well.
I know. I have to ask these questions. I have a 5 and an 8-year-old. I'm one of those anxious parents, so I'm asking for all those parents out there who are waiting to see what that's all going to look like. Okay, so this next question. What impact do you think the White House urging parents to get their kids vaccinated will have on the overall willingness for parents to do so?
I hope that it really encourages folks and that it impacts them to get it done. I think to Dr. Hawkinson's point, we're really trying to just improve the safety of children right now, and I think that's going to be a big step along the way to do so. So hopefully it will encourage parents to get their children vaccinated.
Yeah, I think that's the key, is hopefully, and I think really, unfortunately, this has become a politicized viewpoint, and it really shouldn't be. This is not the economy or immigration or things of that nature. Voting rights. This is not redistricting or census. This is pure medical and science. So we know what things can be done to help protect people, and that's really what we want to do. And we would prefer if it wouldn't be politicized. We know that there is a large attack on just any sort of authority or leadership. But just understand that really we, the healthcare providers, the public health people, the scientists, have dedicated so much time and energy to helping keep you safe, keep the community safe, keep the nation safe. Really, that is our main concern, is staying in that medical lane, looking at the pure facts and the science. And we really need to kind of, if we can, help reduce some of this division and get away from these seeds of doubt that have been sowed. We do this every day. We dedicate a lot of time and energy to do it, to help protect people, keep people out of the hospital. That is our main goal. And so we know that by vaccination of children all the way up through adults, we can do that and keep people a lot more healthy. We know that healthier communities and healthier countries have better running economies, have more stable economies, and that is what we really need to get back to.
Paula is receiving Regeneron treatment today. Does she still need a booster shot?
Yeah, so that's a very good question. So if you're asking if you need a booster shot, to me that tells me that you have had your first dosing. If you are getting Regeneron, that means you've now had the infection. So I would still recommend the booster or that additional dosing. When exactly, there's no good guidance. Obviously, if you were not receiving Regeneron, we would say you can receive your booster or your additional dosing anytime after that 10 days after infection. However, now that you're receiving the monoclonal antibodies, you really need to wait 90 days. But in addition, you have been infected. Now, more than likely, it is Delta variant, so you are developing some sort of specific immune response to that. I think you really have some time to wait. first of all, you have to wait that 90 days because of the monoclonal antibodies. So that's about 3 months. If you really wanted to wait a couple more months after that, I think that's reasonable. But anytime really after that 90 days, you're able to go get that additional dosing.
Rita, thank you so much for joining us on YouTube this morning. She's hearing a lot about whooping cough. How important is it for older adults to get this vaccine?
Yeah, that is a great question. I think that goes back to one of my earlier statements about vaccines for adults. So a lot of times, as children, we do get vaccinated for whooping cough. We have shorter lived immunity, however, so as we become adults, we lose that immunity. And specifically to this question, the biggest problem right now with whooping cough is those parents and those grandparents that are not immune, so they are giving it to those kids that are susceptible in the household who haven't been vaccinated for one reason or another, or are not old enough to be vaccinated. So I think that's a very important question. And what we have now is the component of whooping cough is also in the tetanus vaccine. So you can get those two, as well as another component of another disease, all in the same vaccine all at once. So that is a very insightful question. Would encourage everybody to go get their tetanus vaccine, which includes that component of pertussis or whooping cough as well, because you don't want to spread that disease to those vulnerable children.
Amanda, Joyce wants to know, she lives west of our hospital and saw a life helicopter heading east, and was what it made her think and wonder if hospitals are accepting transfers now, and wanted to know, is our hospital accepting transfers? What does that look like?
Yeah, so we always are accepting transfers. It's one of the services that we provide as an large academic medical center. So yeah, the answer is we are accepting transfers. We have been whenever capacity issues arise, and we have seen that over the past throughout the pandemic. We haven't been able to accept all of those that are being requested, but we are stabilizing that, and that's just something that's part of our business.
So that was a thing, and part of our business is to just reroute if we have to when we get those high numbers.
Absolutely.
But we are not at that place right now.
Right now, I don't believe so.
Okay. So a question, does getting just one mRNA shot give you any protection at all?
Absolutely. I think, obviously we want folks to get if they're part of a 2-dose series, we'd want them to get fully vaccinated, but even one mRNA vaccination provides some protection and is better than no vaccine at all.
Yeah, I think that's the key part of that answer right there is some protection, better than no vaccine at all, but we also have good data showing that it is not as maximal and optimal, as Amanda said, as that 2-dose regimen. So I think the key thing there is you have a little bit of protection, but we have very good data to show that it is not anywhere near maximal protection. And as far as clinically, it's unclear exactly what just getting that 1 dose means, but we know that people are much better protected after getting that full 2-dose series.
So we get that question a lot. So then my question is, why do people only get one shot? Do they have a bad reaction? Does it hurt? They don't like it? They get busy, don't want to come back for the second?
Probably all of those things.
Okay.
All of the above. I think it also may go to the same reason why people take just half of their
Antibiotics.
total duration of antibiotics. And so I think it's a number of reasons.
Okay. So this is also a question we get a lot. Does the vaccine cause heart palpitations, especially weeks after getting it?
I think my response to this is that typically we see the side effects of those vaccines within the first 2 or 3 days. I haven't seen anything specifically that links heart palpitations after the vaccine as causative. So my initial answer is going to say probably not.
Yeah, I would think you'd have more issues with your heart as far as palpitations go when you're having those worst of the symptoms within those 48, 72 hours when and if you are having the chills, the sweats, things of that nature. But to Amanda's point, I don't know that there's really been anything published that shows that weeks after the vaccine now you have a problem of heart palpitations.
So Shirley was asking about this on the feed this morning, and it happens to be one of our questions from the week. Any correlation between certain blood types and those who get COVID and have severe symptoms, need to be hospitalized, and then onto a ventilator?
Yeah, initially there was a lot of discussion of that and investigation. I think it was something with A versus O blood. Overall, there wasn't a preponderance of strong data to suggest that really had anything to do. We do believe there are genetic components to those that do very well and have no problems at all, but somebody who is the same kind of person, same age, same gender, same medical problems or lack of medical problems, who get very severely ill. We do believe there are genetic components that come there, but again, genetic components are not just one thing. There's a lot of complexity to those things. But overall, I think that what has happened is really there continues to be investigation, but there has really been nothing saying this blood type leads to this blood type leads to that. And certainly we know that no matter what blood type you have, you are always at risk of the complications of COVID-19, no matter who you are. So there was some initial reports about that, but none of that has really come to fruition. And then it hasn't really been proven or shown to be clinically important at this point in time. But we know that people are investigating the genetic components overall.
Dixie is asking, can you compare the potency of the half-dose Moderna to the full-dose Pfizer booster?
I can't compare the potency other than we know that there were trials looking at different doses and looking at antibody levels. Again, the antibody levels we're using as a proxy for our immune response, and what they showed was that you develop very good high antibody levels even with that half dose of Moderna. But again, I think overall in the ability to develop an immune response, based on those trials, they're really about the same.
So Lee wants to know, why would a doctor not check antibodies on a child prior to vaccinating them? It's been 18 months since the beginning of the pandemic, and wouldn't a doctor expect the child to have some sort of natural immunity and expect them to have been exposed at some point during this time?
I don't think that we can draw any correlation to what the antibody test is showing as it relates to the COVID, especially related to the COVID vaccines, to like whether or not, I'm not sure I understood that correctly, but like, are they checking it to see, do you even need the vaccine?
I think that we have gotten that before.
That would, we don't, that antibody test wouldn't tell us that, and the vaccine would still be indicated.
And would it matter though? Let's say you have antibodies. I would still want my kid vaccinated, but
Exactly.
Are you saying that some people would say, well, if I don't have to vaccinate, then let's
Well, we
not
hear
do
that.
it?
We hear that a lot, that, you know, I had COVID, and so I should have some natural immunity developed in response to it. But what we know very well is that the vaccine provides even better immunity, especially to the other variants that have evolved since the beginning of the pandemic.
Yeah, you know, I would totally agree with that. Right now, the guidance is there is no need to check antibodies for immunity to COVID-19. And again, because there are so many different commercial antibodies tests out there, they aren't really necessarily checking neutralizing antibody. And so I think that's important to understand. Even people who have been vaccinated, we don't recommend that they test antibodies because that is not the full picture of immunity. Although we do use antibody levels in some of the research papers, we also do understand that it is a function of antibodies, but also T cell responses. I don't think that having COVID in the past should really defer anybody from getting the vaccine. Just as Amanda said, we know that the vaccine does improve your immunity. Now, this continues to be a topic of debate, but we have good basic science research showing that those people that had the infection and got vaccinated have a wider breadth and better neutralizing antibodies to other variants as compared to those people that just had an infection in the past. They don't have those neutralizing antibodies to those other variants that their body hasn't seen yet. So it is very important to get vaccinated even after infection. But as far as checking antibodies, there's really no reason to do that. The guidance is that you shouldn't be checking antibodies either for past infection per se or immunity, or even for immunity after vaccination.
Okay, I have a question. What does a antibody test look like? Is it a blood test, a blood draw? And then how long would it take to even get that back?
Oh,
It's
usually
pretty
within,
rapid.
I was going to say,
It
we
is
usually get it
rapid,
within
too.
a couple of hours.
It's a couple hours.
Okay, that was just my maybe non-clinical.
Yeah.
I have to ask those questions.
Yeah.
Melissa says, we are 51 and 58 and have obesity and asthma as factors. We got J&J in March, worried that it wasn't enough. So then got Pfizer 1 in June. Should we get Pfizer 2 now?
It's a math problem.
March to
It is a
June.
math problem. I don't do math.
That's 2
so.
plus months.
But what about getting the J&J in March
Yeah.
and then getting Pfizer 1 and 2? Is that okay to do?
You know, this group was very proactive, obviously, and obviously what we have heard, they're still with us. sound fine, even though they got Johnson & Johnson and then another mRNA vaccine. Right now, you would really just fall under the guidance of you had Johnson & Johnson, you were more than 2 months out from that vaccine dose, get the Pfizer vaccine. There's really no guidance from here on out. I think it really kind of is open season at this point.
So, okay,
to tell you the
well, I
truth.
just think it's interesting. Some people don't want to get one, and then you got people doubling up because they really, really want to be protected.
Yeah.
And,
That's right.
I certainly appreciate that, especially with
So they were ahead of the game and really did what was just
announced. Yeah.
yesterday.
Right.
I don't have a problem if you go get that dose. I don't think it's needed. You're certainly welcome to.
So would that be considered a third dose?
I would consider that
That's a third dose, or is that considered the booster for
Well,
someone?
I would think that the first dose of the mRNA would kind of be that Johnson & Johnson booster. I mean, it wasn't
Yeah.
the Johnson & Johnson manufacturer, but so
Yeah.
we don't really have guidance on that second mRNA. It would be like the
I
Pfizer
don't think it's
series.
needed from the clinical standpoint. I think you're still going to be very well protected, 90+%. Have your risk reduced of going to the hospital, severe disease and death, even for months out now. You're certainly always welcome to go do
Can you
that,
get
and
to-
it will be safe.
Can you get too much vaccine?
No.
Never enough.
Again, I think
doesn't hurt you?
what we hear a lot is I don't want to put that in my body. I don't want to defile my body. I think we have to understand that, number one, there's no preservatives, which I don't think that really anybody has a problem with preservatives anymore. I mean, the amount of preservatives that we eat on a daily basis is minuscule to anything you would get in a vaccine. So number one, there's no preservatives. They're inert compounds within those vaccines. Most of those vaccines, especially the mRNA, are basically the same components that make up your own cells. The fats, lipids, cholesterol, that helps that nanoparticle fuse to your own cells because it looks just like it. So really, the amount of compounds in these vaccines are so minuscule that we probably ingest more in a week or even in a day than would ever be found in any of these vaccines.
Shirley wants to know, if you had whooping cough as a child, do you need a vaccination now that you're an adult and you're over 65?
Yeah, unfortunately, immunity is fairly fast waning for whooping cough. So it is very important and it is recommended to get vaccinated with Tdap. That will provide your tetanus and pertussis vaccination. So yes, I would say go get that today.
Follow-up question from the week. When do we think boosters will be available for all of us?
Probably coming soon. I think when you say all of us, then you also are talking about the children. So we're still waiting for the younger age group, and so it'll be a while for everyone to have boosters available. But I know we're really hoping that some of the guidance in the next couple of weeks will get those boosters out for a big portion of the population very soon.
Gretchen wants to know, going today for a Moderna booster after having the J&J, how long after does the booster take full effect?
Be the same as what has been with the other series, so within the 2 weeks following that
I
dosage.
mean, I think that anywhere after that 10 days, you're really starting to reach that maximal effect. But I think that the conventional wisdom is still really that 2 weeks after that boost. And again, what is full effect? Is it getting that antibody level to so high that we're looking at? Is it continuing to help clonally expand those B cells and that T cell response? I really think, after that boost dose or that third dose, you're probably going to reach as much maximal effect as you can within that 10 to 14 days after that dose.
So when people go to get their booster, a CVS or a Walgreens, and people ask what their, where they are on the list, their comorbidities, kind of their health history, are they allowed to do that? Is that a HIPAA violation? Can they just ask somebody what their health issues are?
I think as it relates to just making sure that I honestly don't know that they're asking the questions.
I don't know.
But as far as are they eligible to receive it, from what I understand.
Is it a yes or no question? Like,
are you eligible?
Yeah. And
I mean, if they're signing up, I honestly don't know that people are
Okay.
asking the questions.
Okay. Well, that's come up before too. If people could just walk right in,
Yeah.
but you're supposed to be in some order, but soon it won't matter.
Absolutely. And I think there are some components of providing a vaccine where they do have to ask some medical information as far as allergies.
Yeah.
It's like I'm thinking more about the influenza vaccine, but it wouldn't be a HIPAA violation.
Okay, Corey is asking, are there any vaccines that you recommend over others if you have an autoimmune disease?
I think any vaccine.
Any vaccine? Okay, I knew you were going to say that.
I mean, I think you have to talk with your medical provider. If you have an autoimmune disease, you really have to know the complexities of that disease and or that treatment. Depending on what medicines you're on, you have to be concerned is if the vaccine will it work, or will your immune system be so suppressed that it won't work? I would be concerned with things like we heard about, pertussis or whooping cough. I would be concerned about shingles. I encourage everybody to get the shingles vaccine. Nobody wants that rash on their back that causes significant pain, or even more importantly, on their face. It is very detrimental and causes a lot of suffering and pain. So shingles vaccine is very important. They're all very important. And if you're not caught up on them, please talk with your medical provider and get caught up on those vaccines.
Sherry, thanks so much for joining us on YouTube. The booster is still just for people over 65 and immune compromised, correct?
As of today?
As of today.
Mm-hmm.
Immune compromised? No. For those that are immune compromised, you need 3 doses of vaccine. That is separate from the booster. So remember, the immune suppressed population we have allowed to have, if you got your 2 vaccines, doses of mRNA, and then at least a month later you can get that third. Really, that third dose is what we considered fully vaccinated if you are immune suppressed. So you really should have your third dose already. But again, if you are on immunosuppression or you think you have an immune compromising condition, talk with your physician about that.
Jerry, also on YouTube today. Did I hear you say yesterday that you now give the J&J vaccine?
So we have it sometimes. I think it's somewhat inconsistent as far as what our inventory of our J&J. So if it's something that you only want the J&J, I think it would be you might have to call in advance and make sure that we have it readily available, because it's not something that we have like we do the other manufacturers.
Kitty asking, will we need a booster shot every year for COVID-19?
I think that's a good question. I think initially we said when vaccines originally were rolled out, we anticipated maybe a yearly booster or dose. I don't want to say booster, but a yearly dose, just as with influenza we do have yearly. But that was before. Now there's a recommendation after 6 months to get a dose. So it's really unclear. Will 3 total doses be protective enough for the long term that you don't need any other? Or are we looking at 6 to 8, 12 months needing another dose? But then we also have to get into the real granular areas of why are we asking to get additional dosing? Is it to help protect further against hospitalization and severe disease and death? Because we know that these continue to provide long-term durable immunity against those. Now, a little bit less so if you are in that 75 and older population, as we saw in that VA paper in MMWR. Or is it to help further reduce the ability to transmit the disease? So I think we have to ask, number one, why are we getting those? Is it for reduction to help improve your ability to stay out of the hospital, or is it for reduction of transmission? And so I think we just don't have that information yet because the boosters were really just rolled out. But certainly I believe as we get further, and we know really a lot of the Israeli data is ahead on this because they are doing a lot more, we will take that into account along with our information and our data here in the United States to make that best choice and that best decision.
Melissa asks, will kids today even have to worry about getting shingles now that we have the chickenpox vaccination preventing infection? Do you think it'll just go away?
Yeah, so certainly I think what we have seen is that as far as shingles goes, we believe that the natural infection and immunity is probably a little bit better in keeping shingles away. Remember, you get chickenpox. Historically, people have gotten chickenpox as a child. I don't know, Amanda's a little bit younger than I am, but I got chickenpox.
I got chickenpox.
Okay.
I did too.
You get chickenpox as a child, you're fairly well protected, but we know that people even who got chickenpox get shingles. Since the vaccine was rolled out, you may not have as better protection against, number one, chickenpox itself or shingles later on in life. So yeah, the shingles vaccine is still going to be needed and recommended. Unfortunately now, it is only recommended for those 50 and above. And that just, again, plays into the trials that were done and the age groups that were studied. It's probably very effective and very safe for people under 50. But I would encourage everybody who is 50 and up to go ahead and get their shingles vaccine.
Okay, I have to say hi to Kyoko, who's joining us from Kenya.
Yeah.
And it's evening time, so good evening to you, and thank you for joining us.
Kenya.
Love that. Okay, so follow-up question. I had a tingling feeling and some bad headaches after getting my Pfizer booster. Feeling pretty good now, but is that normal?
Yeah, I think everyone kind of responded differently to each dose of their regimen, and I know that I've talked to folks who've had their booster and they had a very similar response to their first or second. Sometimes it's just your immune system, your natural immune system responding to that vaccine. So these would be things that I would probably just expect. Sometimes you don't get anything, and sometimes you feel terrible afterwards.
Yeah, I wouldn't draw any untoward conclusions from that, especially, again, are we talking within that 2 or 3 days after you got the vaccine? I really think that would be part of the normal side effects that someone might feel. If it's, a week, 2 weeks, 3 weeks out, I would probably not have any association with the vaccine. So I think I'm just kind of figuring out what is the time frame that you're looking at.
Linda is asking, is the booster a full dose or a half dose?
So for Pfizer, the booster or third dose is the full dose, which I believe is 30 micrograms. For Moderna, the booster dose is 50 micrograms, which is half of the initial dosing, which is 100 micrograms. Hopefully this will help be able to spread out more vaccine and use more vaccine for other populations. Obviously, we know, unfortunately, here in the United States, there is a glut of vaccine because there just is not enough uptake. We would certainly prefer more uptake, but we also know that it's vitally important because we are only as strong as our weakest link. It is vitally important to get these vaccines to those underserved places and get those populations vaccinated as well.
Marie has a question, Dr. Hawkinson. You can take this one. She wants to know, should she still be wearing goggles and glasses, protective eyewear, when she's on an airplane, along with the mask? She's going to be traveling soon. Is that still necessary, you think?
I would definitely say yes. I flew last weekend. I did wear eye protection. I obviously wore a mask. Masking is still mandatory in those places, so I would say yes. But I think that, if you felt you didn't want to wear eye protection, that's up to you. Are you vaccinated? I just want to continually to optimally protect myself from infection as much as possible, not because of the illness that it would cause, but more for the fact that I would have to miss work if I developed symptoms and tested positive. So I really don't want to miss work, nor miss things like seeing my children or being out in activities with them. So I think that's important to understand. The optimal protection that you're going to gain is from the mask and the eye protection.
Good advice. Okay, a couple more questions. Kitty's asking, if you had shingles as a child, should you get a shingles shot? I think somebody may have asked that earlier, but can you
So I think that's chickenpox, because shingles is the manifestation.
Okay.
After you get chickenpox, chickenpox is the primary infection. That's when the virus, you have all those marks all over your body. The virus is then tamped down and put under control by your immune system, but the virus goes to live in your nerve cells. And then it's not until later. Some people as early as their mid-20s can get shingles, but generally it's much, much later after that. The 40s, 50s, 60s, and on, where you then have more risk of getting shingles. Especially under a stressful condition, it can come out. So yes, again, if you had chickenpox or the vaccine as a child for chickenpox, I would certainly recommend the shingles vaccine when you are eligible. Some people who are immunosuppressed may be a little bit eligible and certainly seek benefit from that prior to 50. But right now, the FDA recommendation is 50 and above. So as soon as you're 50, go ahead and get that.
So how likely are you to get shingles if you didn't have chickenpox and you're not vaccinated? Is that highly likely, or does the stars all have to line up, or how does that work?
If you what?
So if you're not vaccinated for shingles, you had chickenpox, or you didn't have chickenpox, so now you could have shingles. How likely is it somebody to get
I don't know
that?
what the risk is off the top of my head for somebody who had chickenpox.
Or did not have chickenpox and is not vaccinated. So
you have no immunity to it.
Yeah, I would be much more concerned about primary chickenpox infection at that age. And we know that as you get older and you haven't had chickenpox, those people that get chickenpox later in life have more risk of complications and definitely don't have as easy a time with it, if you will, compared to those younger people. So I think you're more at risk of getting primary chickenpox if you haven't had it in the past or have not been vaccinated. And we know that then you are increased risk of problems such as horrible chickenpox pneumonia or infection in your spinal fluid and things like that. We just know that your chance of getting complications from that virus are much increased the older you get compared to younger.
Okay, Kelly wants to know, do you think we would get a better response by delaying a booster to maybe 9 months or a year mark? She said that she had heard that they were thinking that possibly the reason that people responded better to Moderna was because they were further spaced out than Pfizer.
Yeah, absolutely. I would agree with that. I think we had concerns about the dosing schedule early on, but why did they do that? They did it so that they can get those trials through, so they can look at the safety data, so they can look at the efficacy data, and we know that they have been shown and proven to be safe and effective. But if not, then we would still be waiting for first dosing if we were waiting those 6 months. So I don't find a problem or have an issue if you wanted to wait longer. I think that is a good thing.
Okay, couple more. Ashley says, I had chickenpox as a child and recently went to the ER about 3 weeks after getting a Moderna first shot for a major back muscle pain. Turns out it was a very mild case of shingles. She had a tiny scab on her back. Was this because of the vaccine?
I think I've heard some anecdotal reports of that. Very rare. And I certainly would not use this as a reason to not get the vaccine. It is very rare. But it is hard also to draw an association with that. So I would certainly recommend getting other dosing if you can. Complete your first series of that mRNA vaccination.
Okay, last follow-up question from the week. What kind of protection do you think kids 5 to 11 will have after their first vaccine while they're waiting for their second?
Well, as Dr. Hawkinson has mentioned, and we've talked about this all along, that you do have some, I'm not going to be able to give you a percentage, but I think we know that you're going to have some immunity develop within that couple of weeks following that first dose, knowing that it's going to be optimized after you get that second dose.
Yeah, and I don't know, Logan, we may have some of the older, you may not be able to pull it up. There was a large blue and red graph, a big one, and then there was an inset with a smaller one. Basically, I believe from what some of the FDA briefs showed is that really after that 10 or 12 days, you can start to see those infection curves separating. And what that means is those people that got placebo continue to go and have an increase in the number of cases as compared to those people that got the vaccination. So basically, I believe around 10 to 12 days, we started to see some data signals that those people are being protected from infection. But again, that was an adult study, and that was from some of the original Pfizer FDA briefs, but also Moderna as well. So.
All right, we're going to get to our final thoughts today. Thanks, everyone, for your great questions and for being with us this week. Amanda, what do you want us to know as we head into our weekend?
Yeah, so it was a beautiful fall day this morning, a little chilly, so hopefully that doesn't prohibit people from getting outside and enjoying the fall weather. I think it is still very important to understand that the dynamics of how COVID is being spread hasn't changed. So even, if we can stay outside, the risk there is less than if you're indoors hanging around people that don't typically live in your household. There's lots of vaccine available, both influenza and COVID. So if you haven't yet done that, go and do it. But that's really it.
Good to see you today.
Yeah, thank you.
Good for being here. All right,
Yeah.
Dr. Hawkinson.
I mean, I think there were some good questions, not only about COVID vaccines today, but other vaccines. I think it's important. So for some of the moms or dads or husbands or wives out there, if you are trying to maybe get out of some honeydews or doing things of that nature, go get your vaccines this weekend and then use that as an excuse as to why you need to be resting. Get your influenza vaccine, get your shingles vaccine, get your tetanus vaccine, again, which includes whooping cough as well, and of course get your COVID-19 vaccines as well.
I got my shot yesterday. I got my flu shot. Mm-hmm. You're getting yours next week on the show.
I guess we are, yeah.
Yes, you are. If you did not get that memo, yes, you are. Are you getting yours this week or soon?
I have
here?
already received mine. We actually had a little clinic set up for members of my team, and we got it, even though we haven't really seen any influenza within our health system yet, but we had it readily available, so I got it taken care of.
I got me and one kid vaccinated. The other one burst into tears when I brought it up, so I let him off the hook. I said, but it's our tradition. We take him in his Halloween costume.
Oh, great.
To get to make it a little more fun. So anyway, so I let him off the hook for now. Dr. Hawkinson, did you have something?
Yeah, I'm gonna see if Logan can get this up.
Okay. And you're just gonna sit here with me on camera the whole time.
It might take too long to put it up.
It's
No,
gonna
we're
take
not
too
going
long.
on it, so we'll show it. But
save it for sure.
Yeah.
Okay, thank you all for being there. They are right there.
Saying
There's our
no.
guys. That's right. They just can't. They work fast. They just can't work that fast.
Yes, they can't work that fast.
They are not that magical, but they're fantastic. Okay, thank you all for being with us this whole week. We love hearing from you, so get those questions in. Coming up on Monday, as we continue to focus on breast health, meet this young woman. She is a medical student who herself became part of the research that she was doing. She entered herself into a high-risk ovarian cancer prevention program as well. So you're going to hear her story, and also from one of our fantastic Cancer Center medical oncologists. So have a safe weekend, and we'll see you back here Monday at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.